Hello, and thank you for joining me again as we finish up our discussion on nerves. Today we're going to talk specifically about action potentials and how nerve signals are transmitted. So here we go. So how a nerve works is your cell membrane is usually electrically charged. So nerve membranes are charged, or we call them polarized. And the way this works is the inside of the cell has a negative charge, and the outside of the cell has a positive charge. And this is all due to our sodium-potassium ion pump that pumps sodiums out and pumps potassiums in. Those of you that, so some chemistry information. We have potassium has a positive charge. Sodium also has a positive charge. So what we're doing with this pump is we're moving positives from one side to the other. But the way that it works is you pump 3 sodiums out of the cell and you pump 2 potassiums into the cell. And so you have there's a higher concentration of potassiums on the inside. So you see in this diagram there's more K's in here. And on the outside you see more of the blue NAs. Okay, so there's way more blue sodiums than there are potassiums on the outside versus the inside. Okay, so we have way more positives on the outside than we do on the inside. So on the outside of the cell, it's got a positive charge. The inside of the cell has a negative charge, and it's not 100% negative. There's just less positive, so it's more or less a less positive charge on the inside. So there's a positive on the outside, there's a negative on the inside. This is our resting potential. This allows your nerves to fire, and so when these ions cross the membrane, that's what passes the signal along. And so we have some different terms we're going to use. So first one's the resting potential. This is when your nerve cells are at rest. This is the resting potential. This is what allows your nerves to be ready to fire. So this is a resting nerve not being stimulated. This is when you pump all the sodiums out, you pump the potassiums in, and these ions are sitting on the outside waiting to move. The impulse. So this impulse is when you get the signal from the dendrites, which receive your action potential, which sends it to the body, and when your message travels down the axon, these channels will open up and cause positive ions to rush into the cell, causing an electric current. So the nerve impulse is going this way, these positive ions are coming into the cell, these sodiums are coming in because they are diffusing in. There's not remain on the inside, there's a bunch on the outside, so they diffuse in, and this allows your electric current to travel down the cell. When you have myelin covers some of these points where the sodiums enter, and so it takes out some of these little doorways, and that allows the signal to go from, say, this point all the way to here without needing any more ions. So this would be myelin covering this segment, and so your nerve signal will travel. It receives the charge here, and it's going to jump to this next point where you have a bunch of ions flooding in here as well. So that's the myelin, is that it can jump. It doesn't take time for all the channels to open. And so after you have this take place, we have what's called a refractory period. This is the time when your nerve cell has to repolarize, has to pump the sodiums back out, potassiums back in. This takes time. So this is when your nerve can't be stimulated. It has no function at that point. It's got to repolarize before it can fire again. This is looking at how the myelin works. And so this is that impulse jumping. So we have these nodes here. This is where your ions can travel in and out, are at these nodes. And so then it can jump from this point to this point. So these ions travel in, the signal gets to here, and then the ions travel in, and the signal goes to here. So it allows it to go faster. And this is your action potential starting it all. So that's just a look at how this works. And so it goes from point A, and the action potential comes in, and it goes to this point, and they fill, and it comes to this point, and they fill. So that's what myelin does for your nerve cells, is it skips segments, allows it to go faster. At the end of your axon, we have these things called neurotransmitters, which we kind of talked about. And these are your chemicals. So this is an important term you need. So chemicals that cross the synapse, causing different responses to nerves. And you have a number of different ones. Depending on what signal is being sent, depending on what you're trying to do, you have a number of different neurotransmitters that can be used. The one that I arguably use most often, the one that I would say is the most noticeable, is acetylcholine, or ACH. This is located in both your central and peripheral nervous systems. This is involved in the movement of skeletal muscles. So anything that you consciously do is controlled by acetylcholine. So that signal gets sent down an axon, acetylcholine gets released, the synapses on the next nerve pick it up, and it goes on. Some other common ones: you have norepinephrine, you have dopamine. This is your feel-good drug. This is the feeling good. This is your addiction drug. When you get too much dopamine, your body craves that. It craves the good feeling. That's where we get addictions coming in. Norepinephrine can do the same thing. If you have low levels, though, it may lead to depression. And it can control how your body's working. So epinephrine is kind of your fight or flight. Norepinephrine, this brings you back to a normal state. This kind of brings you down from your high, allows your body to get back to normal function. Serotonin is your sleeping hormone. So it's your sleeping neurotransmitter. And then histamine is a pain reliever. Some other ones, you have GABA, you have glutamate, substance P. This is your pain perception. So substance P is the P stands for pain. So this excites your body. It tells you there's pain going on. And then you have your endorphins, which are reducing your substance P feeling and reduces the pain going on. But these are just some different common neurotransmitters. Again, acetylcholine is the big kind of important one that we use whenever we're consciously doing something, whether it's talking, moving, that kind of thing. Here's another diagram of how nerves interact. And so you have an impulse travels down an axon. This is a synaptic knob, so a big bulge. These little vesicles house your neurotransmitters. When they get to the outside, they open up and release those to the next dendrite. And that's called the synaptic cleft. That gap there is called the synaptic cleft. They get picked up by these ion channels, these receptors here. If enough of them get picked up, the signal travels down the dendrite to the body to be sent down the next axon. Here's another look at a nerve, just so you can see some synaptic vesicles here. There's a lot of mitochondria, a lot of work being done inside your nerve cells, sending signals to and from. Here's your gap. So this is the synaptic knob of one nerve, and this is your dendrite of the next nerve. And if enough of this neurotransmitter gets out, your ion channels, your receptors will open, they'll flow in down to the body and onto the next axon. Here's some drugs, and this is what drugs do for you, or what they do to you is they alter your neurotransmitters. So you have different types of drugs. You have tryptophan, which involves serotonin. So this stimulates serotonin to be synthesized, which makes you sleepy. You have nicotine, which messes with acetylcholine and dopamine. So it activates your receptors for acetylcholine, makes you feel want to move and jittery, and your dopamine levels elevate. This is your feel-good drug. So it increases your alertness with the acetylcholine. It makes you feel good with the dopamine. Cocaine, again, you'll see this is dopamine. It blocks the reuptake of this drug, which makes you feel your euphoria, your sense of high. Some other ones. Your monoamine is norepinephrine, which blocks your enzyme degradation, which makes you feel better. Same thing with tricitric and antidepressants, which are looking at mood elevation, making you feel better. But these are all drugs, and this is how they work. They impact these neurotransmitters, which send signals, which impact how you feel. We're going to talk in the next unit about nerves, and so your nervous system is split into two main segments. You have the central nervous system, and you have the peripheral nervous system. So your central nervous system is the brain and spinal cord. So these two pieces are central. The central nervous system, center to your body, are those. Everything else is considered your peripheral nervous system, or PNS. Remember, your central nervous system is surrounded by meninges. Your peripheral nervous system, in some cases, can be surrounded by myelin, which speeds up the impulse and action potentials that travel. But that is your resting potential and action potentials of nerves. So here you should be able to answer questions 1 through 12 now. This section was specifically 7 through 12. So make sure you can answer those questions, and I will see you again next time.